everyone, I'm Alexis and welcome back to the channel. Today we're diving into differences between physician assistants, PAs, and anesthesiologist assistants, AAs. Both of these roles are crucial in healthcare, but they have distinct educational paths, scopes of practice, and career opportunities. Whether you're considering a career as a PA or an AA, or just curious about these professions, this video will give you a clear comparison to help you decide which path might be right for you. Let's get started. Let's start by looking at the roles of physician assistants and anesthesiologist assistants. PAs are versatile healthcare professionals who work across various specialties. These specialties can be from primary care to surgery. PAs work under the supervision of a physician, but they have autonomy to diagnose and treat patients, prescribe medications, and even assist in surgeries. Their scope of practice can vary significantly depending on the state they practice in and their setting of work. On the other hand, anesthesiologist assistants are highly specialized professionals who work exclusively in the field of anesthesia. AAs work as part of the anesthesia care team under the direct supervision of an anesthesiologist. Their role is focused on administering anesthesia, monitoring patients during surgery, and ensuring patient safety throughout the anesthetic process. Unlike PAs, AAs do not diagnose or treat patients outside of the anesthesia care. Now let's talk about the educational pathway to becoming a PA. To start, you'll need a bachelor's degree, typically in a science-related field, and you'll need to complete prerequisite core work in subjects like biology, chemistry, and anatomy. After that, you'll apply to a master's program in physician assistant studies. This usually lasts about 2 to 3 years. PA programs are comprehensive, meaning they cover a wide range of medical knowledge from internal medicine to pediatrics, and they include both classroom instruction and clinical rotations in various specialties. After graduating, PAs must pass the Physician Assistant National Certifying Exam, PANCE. They can then become certified and licensed to practice. PAs are also required to complete continuing education and recertify. Now let's compare that with the educational pathway for AAs. Similar to PAs, AAs also need a bachelor's degree. This is often in a science-related field, but it can be in other fields as well. You do have to complete prerequisites like biology, chemistry, and physics. And then the next step is applying to the master's program in anesthesia. This program typically lasts around 28 months. The AA program is intense, focusing on exclusively anesthesia care. There is also technical aspects like administering anesthesia. Just like PAs, AAs must also pass a certifying exam. This exam is administered by the National Commission for Certification of Anesthesiologist Assistants. They must then also maintain their certification through continuing education. Now, what about the scope of practice? PAs are trained to be generalists, which means that they can work in a variety of medical fields. They have the flexibility to switch specialties, making their role incredibly versatile. There are PAs that work in primary care, emergency medicine, surgery, and even in dermatology and cardiology. Their day-to-day responsibilities can include diagnosing illnesses, developing treatment plans, and even assisting in surgeries. AAs, on the other hand, are specialists in anesthesia. Their entire role revolves around ensuring that patients receive safe and effective anesthesia care. AAs work exclusively under the supervision of anesthesiologists, and they're involved in all stages of anesthesia. These stages can be preoperative, post-operative, and during the surgery. This specialized focus means that while AAs have a narrower scope compared to PAs, they are experts in their field. If you're considering a career in either field, it's important to think about where you want to practice and how much autonomy you prefer. Anesthesiologist assistants are licensed to practice in 21 states and Washington, D.C. AAs work exclusively within the anesthesia care team model, meaning that they must always be supervised by an anesthesiologist. Physician assistants, on the other hand, have a broader practice reach. PAs are licensed to practice in all 50 states, Washington, D.C., and U.S. territories. Their versatility allows them to work in various fields, including primary care, surgery, emergency medicine, and specialties like dermatology and cardiology. One of the major differences between PAs and AAs is the level of autonomy. PAs have the ability to practice independently in some states, especially in underserved rural areas. In most states, however, PAs work under a collaborative agreement with a physician. The level of supervision varies by state, with some states allowing PAs to have more autonomous role, including prescribing medications and making independent medical decisions. Why might you choose to be a PA or an AA? If you're looking for versatility and the ability to work in various medical fields, a career as a physician assistant might be the right choice. PAs have the flexibility to move between specialties throughout their careers, offering a broad scope of practice and the ability to work in different healthcare settings. On the other hand, if you're passionate about anesthesia and prefer to specialize in one area, becoming an anesthesiologist assistant could be your path. AAs play a vital role in surgical teams, providing specialized care that directly impact patient outcomes. For those who enjoy becoming a part of a collaborative care team, the AA role offers a focused and rewarding career. I have plenty of friends that are physician assistants that have reached out to me asking me about becoming an AA. Currently, at this moment, there are no bridge PA to AA programs. Hopefully in the future this will change because PAs would be a great addition to becoming anesthesiologist assistants. So I hope this video has given you a clear understanding between physician assistants and anesthesiologist assistants. Both careers offer exciting opportunities, and your choice will depend on your career goals. If you have any questions, feel free, drop a comment down below. Please subscribe, and remember, even when the journey gets tough, be like a pearl, made from grit, but full of grace. See you in the next video.